Dr. GERARD CUOMO. Let me get my headset on here. Okay. All right, we're at the next step now. We're going to go ahead and take our bite alginate, and I'm going to squeeze a little bit out. There we are. Keep the tip in there as I placed in other recordings. It all takes time. And we'll go right in the mouth. And I'm just going to inject in the inner prox. Maybe toward there at the end. And we'll bring our tray into place. Now, close gently into place. We just look her right in like that. We go about 50 seconds. Alright, that felt good going in. It looked good, looked like she bit down properly. I always like to check on the bite alginates that the patients have actually closed properly. Looks like she has. Alright, sometimes it's a good idea to get this alginate taken before, well before the anesthetic, so that they close properly. Sometimes you have to give them a mirror. Coming up on our time now, so Explorer ready. Scaler ready in case. Okay, timer is on, open. And we've got our little guy in there like that. A little water in there. So right now it's just an undercut. That's all it is, just an undercut. Holding that one in, the mesial undercut, but it came out nice. Now you want to get all this flash off. Now I have the light lowered because I don't want to prematurely set the material. So that looks good. Now we have to scrub, diligently scrub with chlorhexidine gluconate. You just never know when you've got a allergy to any of this material, right? You just don't know. So you just use a good soap. Keep scrubbing. Scrub the lower as well. Just start rinsing a lot now. Just rinse, rinse, rinse a lot. Sure. Like I said, we'll use Duralon cement at this point. She still has the first cord in there. Here's our temporary. Nicely done. Alright, and well, let's get right to work on trimming that up. Alrighty. Alright, looks like we don't even have to do any add-ons here. This looks really good. I don't see any voids. Should be in good shape. So we'll just take our diamond. And this is what I normally do at every appointment. I don't see one. And trimming facing the margin, facing the margin. If I did it this way, it'd be everything's in the way, so facing the margin toward you. Let's increase the mag. Take advantage if you have it. Hope everybody's having a good day out there. Day after the 1st, usually that's like a Monday for everybody if you're going back to work. What's the old saying? They say feels like your body's here but your mind isn't. Alright, looking good. And we got pretty good coverage on our margins. Okay, so now what I'm doing is I'm just trimming the inside, getting rid of all this excess material that sometimes it doesn't set internally because of the air imbibition or just materials, just got a funny characteristic. So I just go in and just clean it all out of there first. And that makes the Duralon cement stick better. Alright, we're ready to try this in. So I got it in a rough form. Let's get the excess material out, so that's the next step. Alrighty. Go right in the mouth. Articulating paper next. There we go. I'll just push that in gently. Okay, let's see. Close together. Tap, tap, tap. Feel it hitting? Yeah, not really. Feels good? Alright, we'll mark it. Close. Do that again. Tap, tap. Grind. Good. Open. Perfect. I got a little adjusting to do, so I'll do that. It fits like a charm. I just have to polish it and we'll glue it in. Looks great. So the next step is eccentrics cup. We used this on the prep. Now we're going to use it on the temporary. And those are the markings. So just adjust them lightly first. Should be very relaxed when you make your temporaries. Getting rid of any rough edges. That's it. And then we'll use what we call a Robinson brush or a bristle brush, doing that next. Alright, so straight attachment, Robinson brush. Alright, you can see it's almost like a smear layer. Just take that off. Alright, and we'll switch. Go to a Robinson. And after doing this, you'll see that there's some lines you have to go back in and clean up. So just take your time, do it right. Alright, so that lingual, she'll feel that with her tongue, so you just go right on back to the and just polish that out. That's why I like the cup. I can actually just set it on its side and polish that right out nicely. Now that's a little overhang right there, so you can hone that better. There we go. And near the gum line here on this side as well. So I would say the smoother the better, but don't overdo it. Now we're getting our Duralay ready, or excuse me, our Duralon. Duralay is something else. Duralon from the polycarboxylate cement. I used it when I was in dental school. Still use it today. Only it's a permanent cement used as a temporary cement. Bristle brush again. You don't even need to add any polishing agents. Don't waste your money on that. Just get a nice Robinson. These last a while. You can get rid of them and then get some new ones in the office. Oh, right. That's what we're used to seeing. Something nice and polished. And we can clean up the cement a lot easier. See the inside? That's all got to be cleaned out. So Just dry that. Now, I'll have her squeeze down on a 2x2 cotton, and we've got to go back in the mouth. But before we do that, we're going to add a little Vaseline to the contact area only. That's all we need to do. And that would be right here. Just in case it becomes difficult in between the teeth to clear that. All set. Back in the mouth. We're going to make sure our patient's dry. We need a dry angle in order to make that happen. And then a hair dryer. Anything coming back to life? You're okay? You're good. Okay, so we want to make sure she's dry. Still got a Siltrax cord in there. Again, they answer the one question from a dentist. They asked me a question about, why do I leave that cord in there? Well, this is why, not only in the temporary but in the permanent. Then it comes out at the end. You don't want cement to go down into the sulcus, and you sure don't want curvicular fluid to get up underneath and make a tooth sensitive. Alright, so here we are. There's our cement underneath. Slide that into place, push on it, rock it in a little bit. 2x2 gauze. I fold it once and then close gently down and squeeze a little, and that's good. And open. Okay, tap, tap, tap. And that sounds good. Does it feel good? Yeah. So back in with the gauze. Now notice this cement likes to stick to everything, including the gauze, which is good. Just close down again and stay closed. And that's it. So pretty much it's from here it's straightforward. I'm going to pick this up again next time when we go through the cementing process and also the try-on phase. So what we didn't cover today was the shade, but it is a BL4, and we'll see how well our lab matches things up. So, and also I'll go through some fit checking with you if we have any. I've been using a lab that really just is such minimal fit checking. So so we're going to get ready. We'll have 3 bowls ready of Snapstone and a wow. And I'll be right back there to help you pour that up, Paul. Thanks for watching today. This is Dr. GERARD CUOMO. We'll see you next time with tooth number 2, molar Emax crown. Take care. Have a great